Welcome. I'm Dr. Ogan Gurel. This is Insights in Medicine, brought to you by InTimeTV. We have another great hour ahead of us with a fabulous guest who has appeared on a number of public shows and so forth, and we're really honored to have her. Our guest today is Dr. Annabelle Volgman. She's a cardiologist, director of the Rush Heart Center for Women, and it's great to have you. Let me give a little bit background on Dr. Volgman. Many of you may actually have seen her and heard of her work, but she's from New York City and graduated from Barnard, part of Columbia University, in biology with a minor in chemistry. Graduated from the College of Physicians and Surgeons in New York, my alma mater as well, and came to Chicago for residency in internal medicine at the University of Chicago, and did her fellowship in cardiology with specialty in electrophysiology at Northwestern. And since then, still in Chicago, has been at Rush as an attending for the past over 18 years, and is presently director of the Rush Heart Center for Women. So great to have you, Dr. Volgman. Can I call you Annabelle?
Yes, of course. Thank you, Ogan. It's a pleasure to be here.
And the topic for today is women's heart health, issues in women's heart health. Obviously, you're an expert in the area, but it's an evolving field and one in which general practitioners, cardiologists, and there's a lot of new information. So what we'd like to do in this hour is really develop this topic and learn your insights.
Well, as you know, the Framingham study has given us a lot of information about heart disease and what is the cause of mortality and morbidity in the people in the United States. And as I'm sure all of us know, the Framingham study was started in 1948 after Franklin Roosevelt died of a stroke, and nobody really understood what caused his stroke. And as a result of that, the Framingham study was started in the 1950s. So in the 1950s, people in the Framingham town were being followed. And in the 1970s, 20 years later, those 20-year-olds that were being followed started having heart disease. Men were dying of heart attacks. And what they noticed was that women were not dying of heart attacks.
Right.
So I think all of us were misled that heart disease was a man's disease because of that study.
In terms of the initial results?
Initially, yes. But then 10 years later, the Framingham study again reported that women were now starting to die of heart attacks. So it was the women in their 50s. So there's that 10-year gap that really is so important because it made us all think that heart disease was only affecting men. But those 10 years made a huge difference. Women started to smoke. Women didn't take care of themselves. They thought that they were immune to this heart disease, so they didn't take care of themselves as much.
So it's not just the aspect of heart disease occurring later in women, but to some extent, the initial studies created a framework that perhaps women were not protected as much through the lifestyles and so forth.
I think that